A little more tired. Help! What do I do? That's when you turn to Neutrogena Dermatologics. And I want to introduce you to a gentleman you may already know. His name is Dr. Will Kirby. He's a board-certified dermatologist, and you have seen him on a slew of television shows with zip codes attached to them. And you have a practice in Beverly Hills. Isn't that correct?
That's correct.
So
welcome back from vacation.
Thank you. Nice to see you, too. Now, this is sort of coming along right after the immensely, hugely popular serum that Neutrogena Dermatologics had brought to us here at QVC, which, for those who aren't familiar, they're saying, can I get Neutrogena at the store? This is like the highest end, most concentrated, sort of scientific version of what you find in the
Exactly
stores.
right. This is Neutrogena Dermatologics, which is the advanced science division. So Neutrogena is a name that we all know and trust. #1 product line recommended by dermatologists like myself. Neutrogena Dermatologics, the advanced science division, even one step up.
And this is a retinol eye cream, and you can ask about it on auto delivery, which of course is the way I suggest to go, because then you can lock in the price as long as you're in auto delivery. Every 60 days, you can ask about it for a one-time shipment, but this advanced order price is only for a limited time, $48.96, and lock that in. Again, it will ship on December 2nd. So let me ask you, first of all,
please,
when you're using, there's so many different eye creams out there.
So much confusion.
There is so much confusion. It's like looking at the wall of vitamins. What are we supposed to do? With this, there's really kind of like a 1-2 knockout, 1-2-3 knockout system.
I mean, right now it's 1-2 knockout system. I always tell people, take a step back, open your medicine cabinet. If there's products in it that you're not using and you haven't been using them, throw them in the garbage and let's make things very, very simple.
Right.
Now, I tell my patients, one of the most incredible, nicest compliments you can get is when someone tells you you look really refreshed and really rested.
Right.
That's exactly what this product does. Superior brightening and anti-aging benefits is how I sum up this product.
Right.
The eyes, thinnest skin on the human body, and as a result, it's the first area that you see the signs of aging.
And they don't make their own moisture either.
They don't.
Skin is just not.
That's exactly correct. They don't make that sebum and that oil that we do like to see in other parts of the face. And I tell my patients the face is very, very forgiving with one exception, and that's the eye area. The eye area is exceedingly dry. And if you look at a picture of yourself recently, compare that to a picture of yourself 5 years ago, 6 years ago, 7 years ago.
Do I have to?
You don't have to, but if you do, you'll notice the signs of aging around the eyes. And that's why you need something for the eye area.
And what's so nice about this is immediately when you put it on, I feel personally almost like a cooling sensation.
Well, that's exactly correct. In fact, a clinical study was done, and with just one use, dermatologists noted improvement in the crow's feet and the under the eye wrinkles.
Right.
But there's 3 ingredients in it that really power this product. Let me tell you about those.
Sure.
One is a stabilized form of vitamin C. We all know what vitamin C does. It's a strong antioxidant. Gives you that less tired, more refreshed look. The second thing is biopeptide CL. That's what biopeptides are, amino acids. Those are the building blocks of life. That helps with moisturization around the eye and under the eye.
Right.
And then the third ingredient is one that you guys know I love. If you ever watch me on QVC or anywhere else, retinols. I love retinols. What do? Increase surface cell turnover and bring up that more youthful skin.
Right.
So retinols are absolutely imperative. You have to have a retinol. If your product does not have a retinol, I wouldn't recommend using it. Every product that I use personally, and I'm a dermatologist, has a retinol in it.
Well, you know, and the thing is, when you're putting things around your eye, there's a lot of stuff out there that you cannot get near your eyes.
Very true.
So the fact that you can help to maybe experience some of that increased cell turnover and get it around the eye area, it's what it's meant for, is really amazing. So my question for you is, do we just put it underneath, or do we put it underneath and on the top?
I'm so glad you asked that. There's 6 areas, going back to the study, 6 areas were done to determine how do we define the aging of the eye. How do we define that? 1 is crow's feet, 2 is under the eye wrinkles, 3 is fine lines around the eyes, the lines of expression, which I call the smile lines, dark circles under the eyes, and dryness. Those are the 6 areas. And in this clinical study, all 6 areas showed improvement.
Wow.
So this product, not only does it brighten, it helps with anti-aging benefits in all that area, including moisturization.
So maybe you have an eye cream right now that really isn't giving you, look at the ingredients in the back. A lot of eye creams just have moisture in them. And moisture is not a bad thing. Moisture is a great thing. But if you're really not getting all of these other areas addressed, you're only really looking at just one tiny little sliver of the entire problem.
Very, very true. You have to have that increased surface cell turnover from the retinols. That's why a retinol is so imperative. Now, people say retinol sounds a little good too good to be true, and it is. It causes a little bit of redness, a little bit of tingliness, a little bit of dry skin. That's very normal. That's a sign that I'm encouraged. That means it's working. And so you might want to start with it once a day. I can use it twice a day, and I recommend it twice a day if you can use it. But those are all signs that the product is working. So you can have a little bit of irritation. I'm very comfortable with that.
And that's really what's really kind of important about this, because again, you can use it in the morning, at night if you want, but you want to, like when I said I put it on my hand, you can feel something is happening. It's like almost like a tingling sensation. So don't be worried. My question to you is, if someone is using it in the morning, What do? I just wait a few minutes before putting them on my makeup?
Really simple. You just take a droplet-sized amount, dab,
Okay.
dab, 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 thin layer, pat it in all around the eye.
Pat it, okay.
Let it absorb 2, 3, 4 minutes. It'll absorb in beautifully. It's really, really humectant, has a nice sheen to it, and then put your makeup on.
Put your
Super
makeup on when
simple.
you're done. So like brush your teeth in the meantime and then put your makeup on when you're done.
This will add 5 seconds to your regime, and the eye area is the most important area. That's the first sign we see aging in that area.
Yeah, well, we're looking at that's what you're looking at when you see someone as their eyes, and they're going to see that. So let me just bring to your attention, too, over 3,700 of these advanced orders have now been taken, and there's 2 ways to order this. I personally recommend auto delivery. Why? Because you're locking in this advanced order price that is only going to last for a limited amount of time, and you lock that in, and that literally is just about a $10 savings every time you get your shipment coming to you, and that's every 60 days as long as you stay in the plan. However, you can only do that until December 2nd. After that, if you decide to go on auto delivery, you're going to be paying a different price. You can go for the one-time only shipment, but really, if you love it, go for the auto delivery. Because if it's not what you thought it was, you can always cancel that at any time, but you want to keep the benefits of that, the savings of the money coming to you every time you get the product coming home. And you know what? I don't ever think that it's really too early to start using a product like this. I mean, even if you're in your late 20s and you're saying, well, I don't think my eyes are really kind of aging yet, this is just going to help prevent seeing some of those signs, because when they're there, they're there.
Well, it is a lot easier to prevent something than it is to correct something, but 2 main groups showed improvement with this. Those are the people who already had the signs of aging, which is most of us, and then also you can use it prophylactically. So from the oldest person to the youngest person in the study, every single person showed improvement. 86% of people in it showed fresh, more rested appearance to the eyes.
Wow.
86%. It's an incredible statistic.
And let me tell you, none of us are getting enough sleep these days.
Absolutely
the holidays
correct.
aren't even here yet.
and you're already stressed out and not getting enough sleep.
Exactly. So if you can fake it a little bit and let your cream do that kind of work for you, by all means, take advantage of the cream, let that do the work. But again, you have to have the key ingredients like what you're seeing in here in order for this to work for you. Maybe if you've had a chance to try the serum that Neutrogena Dermatologics has brought to QVC that has been absolutely huge. Because of the success of that, this is the next step. So you can use this eye cream in conjunction with that serum. But even if you use nothing else Neutrogena, add this into what you're already doing, and you have nothing to lose but maybe a couple fine lines, right?
Brightens and refreshes. That's why people should use it.
A little over 4,000 people have now taken advantage of the advanced orders. Dr. Kirby, always a pleasure to see you.
The pleasure's all mine. Thank you very much.
Thank you. Brand new this month.